Chief Nursing Officer here at SSM St. Mary's Hospital in St. Louis. And we want to welcome you to our first, what we're calling Cup of Joe with a CNO. We don't have any coffee with us at this time, but this is really just our opportunity to have some discussion with some of our high-performing employees here at the hospital. So our directors and our managers have recognized some nurses and care partners and other people in their department as what we're referring to as high performers, nurses and employees that really go above and beyond, that we want to recognize. We want to make sure that we provide them opportunities for development and that we have them working here at St. Mary's with us, taking care of our patients. So our first high performer I'm very excited to announce is Megan Krupp, and I'm actually going to turn it over to her so she can just give a little bit background about where she works at here at the hospital, how long she's been here, and anything else she wants to share.
Thank you so much. So like she said, my name is Megan. I actually, when I was a senior in nursing school, I did my preceptorship, and then I worked like at a pediatric office for a year, and then I kind of felt the calling to come back to the hospital. So I have been on Mother Baby at St. Mary's for going on 7 years in September. So that's where I am now.
And her director really spoke highly of how she transitioned from a physician's office to Mother Baby and how she quickly caught on. She read books, she self-taught herself, and just did an amazing job on transitioning here with us. So why don't you share, I'm always interested to know why people go into healthcare and in the nursing field. So do you have a reason or anything you can share around that?
I think I always have wanted to help people, which I think that's like the number one thing for nursing. Like, of course you have to know like the pharmacology, the science behind it, but I think I'm more called to just like be there to help people and support them at times when they might be vulnerable. And it might not seem like when you have a baby that it's like a happy time, but it is like an emotional, vulnerable time. So that's, I wanted to be a part of that and help people along that journey when they're like having a new baby or starting a new family. So.
That's really special. And whenever you have that passion, it really shows in your work. And Brenda said that she has a very passion around really making it a family experience, making sure there's that bond, and really just making sure that even when it may not be the best delivery or the best situation, that she really does put joy in her patients' lives when they're here with us. So that shines through your work here for us. So, you know, we hire nurses all the time. What would you give a nurse that is either newer to the field or that is coming here to work with SSM? What advice would you give maybe to yourself at the beginning of your career, and maybe what would you give somebody now?
I think that, well, I was actually born at St. Mary's too, which is kind of a fun fact.
Oh,
but
I love that.
Yeah.
And now you work on Mother Baby.
Yes. And actually one of our nurses like retired maybe like in the fall, and she was here for like 45 years. And I'm like, you know, you probably took care of me when I was born here, because she always worked in OB. So I think I just really like SSM, and I mean, I think, you know, we all have the same mission and values, but at St. Mary's, I feel like it's like the little engine that could, like everybody is like the same people that have been here, like from the dietary worker to the UBS, the environmental service people. It's like the same people that you see, and it's nice to have that camaraderie in that community. So I know it sounds like cliche, but I really do try to like really live the values like through my work, which I know they're all right here. But like yeah. I really think it's important to have like that just brings purpose to my work. And so I think that as a nurse working for SSM, like especially since we on Mother Baby, we are also a teaching hospital and we have residents, and so just having that like collegiality and asking questions and like putting yourself out there. And I mean, we're high risk on Mother Baby, so we see like a lot. We see the whole gamut of like whether they're medically high risk or have socially high risk situations. I mean, you'll get a lot of good experience, and so just stick with it, and it's fulfilling.
Yeah, stick with it is good advice. Nursing is, well, in healthcare in general, it's selfless work. and this is the year of the nurses, which COVID definitely has shown that nurses are, important to the healthcare field and to patient care. So that's right, stick with it. It can have good and bad days, just like anything.
Yeah.
So you've been here 7 years. So where do you kind of see yourself in nursing? What do you like best about nursing here at the hospital?
My favorite part of the nursing is like being present with the patient and educating them, which I feel like a lot of times that's my favorite part. So I like to spend a lot of time with my patients, but then I'm like being pulled in a lot of directions. So it's a challenge sometimes. But I actually just finished my master's in nursing education. So I think I'm not exactly sure what that looks like, but I will be in the fall, like teaching a little lab section at SLU School of Nursing while still working full time here. But so I'm not really sure, but I just finished, so I'm kind of navigating the next step, but something in education. So whether that's in the hospital or in the community. So
yeah. And Mother Baby has a lot of opportunities with outreach and even here at the hospital. So make sure that we develop you along the way. So congratulations on getting your degree.
Another thing that I would offer to like a new nurse is to get involved in your units, like being part of committees to help like drive change and make decisions. Like for example, I am like the safe sleep champion for our unit, which is really important because like our community sees a lot of infant mortality related to sleep-related deaths. So it's really important that we're it's right from birth, like modeling safe sleep practices so that they continue to be safe at home. And then also like I'm a part of the neonatal abstinence because of the substance use disorder and like the opioid epidemic. We really are pioneers here at St. Mary's in the way that we care for those moms and babies. So, and I was kind of part of that initiative how we implemented that on our unit, which is like one of a kind in the area. I know that when moms come to St. Mary's, they're getting the best care for their for that kind of vulnerable moment in their journey. So just being involved in that is really special, and to see it come to fruition like on the unit. So just getting involved in being a part of committees and going to meetings and things like that so that you can be part of the change to do better for your patients.
Anything else you want to share just in general? I mean, this is about you, and I'm just honored to sit here and be able to connect with you, and we'll talk more about getting to know you afterwards, but just anything else you want to share for anyone out there?
I think that, I don't know, this is awesome, I don't know, thank you so much. But I don't know, I'm just like proud to work for SSM. Like I think that we do have I mean some days are really hard at work, but at the end of the day, like I am glad that I'm here, so.
Well, we're happy to have you, and congratulations on being our first Cup of Joe and our high performer.
Thank you so much.
Good afternoon, and welcome to our first edition of the Cup of Joe with the ADNO. It is the afternoon, so my coffee was gone a long time ago, so I don't have it with me, unfortunately. But this is the time, similar to the Cup of Joe with CNO, where we sit down with some of our high performers and just get to know them, see what brought them here, and what we can do to make their life easier. So I want to introduce my first high performer that I'm interviewing. This is Katie Jost, and she works on 2 West, which is our surgical unit. So why don't you tell us a little bit about yourself and what brought you to SSM, maybe?
Sure, yeah, so like Gina said, my name is Katie. So I started here at St. Mary's in 2007, actually, when I was still in nursing school as a care partner in the float pool. When I worked, I got to see all the different departments and kind of meet people throughout the hospital, and liked it so much that when I graduated in 2008, I stayed on 2 West, and I've been there ever since.
So what made you want to be a nurse?
Like most nurses you would ask, obviously, I just got into it because I love patients, I love taking care of people. I love the contact, with the patients and the family, and just the rewarding experience of getting to see them through, what's probably a tough time in their life. And of course, on top of that, also just the flexible nature of the job. As a mom of 2 small children, that you can do different hours and different shifts and still be able to be home with your kids too. Just a perk for sure.
So you work on 2X, which is surgical. So what is special about that unit to you that has kept you there for so long?
Yeah. So there are several nurses actually on our floor that have been there 10 years or longer. We have a pretty high retention rate. So it's just, as cheesy as it sounds, it's a family. Like, it's your family away from your real family, that we've gotten to know each other and grown up with each other. And it's just, everybody works well together. And, teamwork is essential in nursing for sure, that you can trust the people and that, they're going to be there if you need some help.
Awesome. So if you could go back to when you were a new nurse, what kind of advice would you give yourself?
Well, and I've had the opportunity to train several nurses over the past, 12 years, and a lot of times what they're most concerned about is that you're not going to know everything, that you're not ready, and when you get out of orientation. And my answer to that usually is, you're right. Like, you're not, there are going to be days that you don't know the answer to something, or a patient or a family member asks you something, and don't be hesitant to say, I don't know, but let me find out, or I can help, or I can go figure that out for you. If I was on the other end, if I was the patient, I would want the nurse that's gonna, admit that they need some help and step up and go find it.
So what is something going through this pandemic that you have learned, or that has been eye-opening or new to you?
It's just the uncertainty of it all. Even working in healthcare, there's still new things that we're learning every day, and things that are changing, policies that are changing, things that you haven't thought one way for years, and things are, people tell you something different, so that's been interesting. And then, taking care of patients during it, with not being able to have visitors up here, has been an interesting aspect. I had a patient that, was newly diagnosed with cancer and wasn't able to have her family up here, and that was definitely a kind of an eye-opening experience. If it had been my grandma or my family member or somebody in the hospital, that I would have, wanted a nurse that was there to comfort them.
So you are recognized as a high performer, and your team and your managers say that you are wonderful, and that you were always ready to help anyone and be either that leader as a CSN or an informal leader. I'm curious what you think has got you to a place where you are a high performer, and what things you have done or education that you've sought out to help you just grow as a nurse and become someone that everyone loves.
Well, thank you. I think it's just, being flexible and being able to get along with people. Really, that's what it is that the teamwork, and being able to, something doesn't always go exactly as it's planned, and if you need to change your course of your day and be able to help somebody else out because you see that they're struggling when you're not at the moment or something like that, that's a big part of it. And it's just having the trust with your coworkers that they can come to you if they are drowning, or if they need something, and that they're gonna come to you and not be scared to speak up.
Is there anything else that you want anyone watching to know about you or SSM or your floor? Or?
Yeah, so when I started as a care partner on the float pool, not just our floor is kind of a tight-knit little family, but just anywhere in the hospital, if you go, you're gonna run into a dietary worker or an EDS worker or a physical therapist or occupational therapist or somebody that you know or that you've seen from another floor, and everybody's just kind and likes to say hi to you or ask how your day is going, and it's just a great place to be.